Hello students, in this small presentation I will be discussing about the concept of polar screws. So the term polar has been derived from a Dutch word polar, which means a retractable block on the road which guides the traffic in a desired direction. So if the block is in this area, then the traffic will have tendency to go in this direction or in this direction. So it has to redirect the traffic in a desired path. Similarly, in bone, the polar screw is placed in an area where we don't want the intramedullary device to pass. So the intramedullary nail, which is going here, will be blocked by this screw, will resume a path somewhere here, which will be the desired path. So if we see the intramedullary canal of a long bone, there is proximal diaphyseal region, then there is middle diaphyseal region, then there is terminal diaphyseal region. And if we see the canal width, the proximal canal is wider, then there is zone of uniform intramedullary canal, which is narrower. Then in the lower part also there is wider canal, which is non-uniform. So the nail which will be passing in this area will not be uniformly fitting in the intramedullary canal. However, the nail when passing through this area will definitely be better fitting compared to the proximal part, and the nail when passing through this area, which is again wider, will not be uniformly fitting inside the intramedullary canal. So when there is abnormal fit of the nail inside intramedullary canal, there are chances of displacement. Why? Because the canal is non-uniform. So the proximal fragment can displace even when the nail is centrally passed through the proximal canal if the fracture is in proximal part. In the central part, the canal is narrow and uniform. So the nail will have uniform fitting throughout in this area. So the fracture which will be here somewhere in the middle part of the diaphysis will have less tendency to displace because the nail is having a good fit proximally and distally to the fracture. And a fracture which is in lower third of the diaphysis, again the canal is wider and non-uniform. So even if the nail is passing centrally through this fracture zone, there will be chances of displacement of the fracture. So the reduction needs to be maintained throughout when passing through the zones of proximal and distal part of the diaphysis. However, in the middle part, there are less chances of displacement because of the uniform diameter of the intramedullary canal. So if we see a simple diaphyseal fracture in the middle part, the nail will be passing centrally through the proximal part and will be passing centrally through the lower part also adjacent to the fracture site. So there will be uniform containment here. Again, nail is narrow and uniform, and it will guide the nail centrally through this zone like this. Only thing we need to ensure is that our guide wire is placed centrally in the distal part, and the entry point is according to the manufacturer specific guidelines. Now if we see the proximal diaphyseal region, if the fracture is somewhere here, now I've told you that there can be chance of displacement of proximal fragment even if the nail is passed centrally. But sometimes there is tendency of nail to go towards the medial side of the fracture because usually we make entry through the lateral part. So we definitely have a tendency to push the nail more medially. And if the fracture is here, so there will be chance of displacement owing to the non-central placement of the intramedullary nail. And in the lower part, there will be chances of central placement of the nail. Why? Because the canal is uniform and the nail will be very well contained in this uniform canal. So because of the non-central placement in proximal fragment and central placement in lower fragment, there will be chances of varus angulation like this. And distally also there is wider intramedullary canal. Again, there will be chances of varus or valgus angulation of the fracture even if the nail is centrally passed. Sometimes this occurs because of the inherent tendency of the fracture to displace, and sometimes it occurs because of the non-uniform pull of the muscles. And sometimes there is combination on one side of the fracture. So the nail will resume a path which will have least resistance. So the tip of the nail will go toward the side of the combination. So here there is medial combination. Therefore the nail will pass more towards the medial at the fracture site. So there will be chance of valgus angulation because of this. On the contrary, if there is combination somewhere here, the nail will have tendency to go somewhere here and there will be chances of varus angulation. So how to avoid the loss of reduction when passing the intramedullary nail near the fracture site? First of all, you have to ensure that the guide wire is centrally placed in the canal and in the terminal part of the diaphysis. And we have to ensure that the reduction is kept stable when doing the reaming process, because the reaming will create a track for the nail to pass. If the reaming track is not correct, then definitely the nail will resume a path which is not normal, even if we reduce the fracture when doing the nailing. So the reaming should be done in an appropriate reduction. And when the nail is passing through the fracture site, we have to ensure that the reduction is maintained. And when these measures don't help, then we can use polar screws or some alternatives of polar screws in form of steel and pin to block the abnormal path of the nail. For example, if you see, if there is translation of the proximal fragment, the nail is passing medially in the proximal fragment and then going laterally into the distal fragment. So to avoid this translation, we have to check what is the abnormal direction in which the nail is going. So the nail is going medially in the proximal fragment. So we have to block this area with a polar screw. If we place a polar screw in this area, then the nail will have tendency to take a path which is lateral to the abnormal path. So that will help in prevention of translation. And if we see the distal segment, the nail was going more laterally. So if you want to put a polar screw in the distal segment, then we have to place the screw on the lateral side. And because of the lateral placement of the screw, the nail will resume a path slightly medially in the distal fragment like this. But be careful when placing the polar screw. Better place the polar screw in the area where the canal is wider, because we should leave some room for the nail to pass. If we place a polar screw in already narrow track, then we'll face a difficulty in placement of the nail through the narrow canal, and sometimes will fail to pass the nail also, and this can result in iatrogenic fracture also. And in this example, if you see, there is combination on the medial side and the nail has tendency to go in this side. So we have to place the polar screw on the medial side somewhere here, so that the tip of the nail is guided more laterally, not in this direction. So this will be the position of our nail if we put a polar screw on the medial side. So this will be the concept of polar screw. We have to place the screw in the abnormal direction of the nail so that it can be blocked and the nail passes through the alternate path. Thank you.